Am I good?
Yep.
My name is Josiah Dulek. This is for Communications 250, and this is the informative speech. It's March 17th, 2018, and it's 6:30. All right, I'd like to thank you all for coming out today. We're going to go over a little informative speech on CLS, but I'd like to go over a quick joke. What do they call an ambulance?
A tow truck.
A boo-boo bus.
Oh.
Alright, so anyways, as I said, it's going to be an informative speech on CLS, which for those that don't know, that's Combat Lifesaver. Brief history of CLS. We didn't go as far back as World War I and World War II. There wasn't CLS as today knows it. They just had their medics who were the full force. They were the ones who had to run out foxhole to foxhole, grabbing the patients, bringing them back. They were the only first line of first aid. So the very first, also with CLS, there was people at IFAKs, which stands for Improvised Field Aid Kits. With that, the very first ones that came with it was just a pressure dressing and some antibiotics. And that pressure dressing, I brought one with me actually. So with it, there was many forms of it. The first ones came in tin, then they moved into plastic and back to metal and brass. But to go with that, the Army was needing those supplies for other things, so they went back to paper, and then they put it in a hard wax to make it waterproof. And all it is a pad with 4 strings on it to tie and press down, and then on it it says for the red text to be that side up. From there, the Army then stopped using the antibiotics with it because they realized that giving those wasn't necessary. First line. Moving on to the Korea and Vietnam War. It got a little bit better. They had helicopters that would go down and they would pick up the casualties closer to the front line and bring them back to hospitals. As far as CLS classes go, it's unknown the actual date that it started, but that then became another form of treatment for casualties. No, it's no longer just the responsibility of the medics. You now have other people within your unit who are trained as far as first line aid. And then in 2005, the Army started issuing IFAKs, which I brought one of those with me as well. This is one of the standard IFAKs. It comes with a form of attachment to attach it to your gear. And then with inside, we're going to get in there as well. Now with it, the Army realized that the main cause of death was hemorrhage. So, of course, they put in a tourniquet. With this tourniquet, you're able to stop all major bleeding from limbs. And what it does, you have the part that wraps around the limb. It comes with the windlass strap. And then there's a material that runs within it. So that way, once it's tight, you can then twist it. And it'll tighten up and it'll cut off the blood flow to arms and legs. Once the Army realized that this saved a lot of lives, they started giving it to everybody. To go along with bleeding, the Army also issues out combat gauze. Within the combat gauze, it comes impregnated with an agent that will stop the bleeding. And that's what this blue line is in here. And for this, all it'll do is you will then just press it all into the wound, hold it in there, put a pressure dressing over it, and that'll stop the bleeding. So as I said, bleeding was the main cause, so of course the Army kept putting more things in there, such as a pressure dressing, formerly known as an Israeli bandage. It's now just a pressure dressing, and with that, that'll be for bleeding as well. You can do this for cuts, gunshot wounds. It's really hot, you can use it for burns. And then all these pieces of equipment CLS is trained on. So they can go in and they can help save lives. So again, you get your padded piece in there with some, similar to an ACE wrap. You would wrap it around the affected area. You would bring it through the loop. And then you wrap it back on itself to apply extra pressure, continuously going all the way around, making sure you cover both ends of it. And that ensures that there's enough pressure on the injury. Then the Army realized that breathing was the next thing that they had to take care of. So they put in NPAs, nasopharyngeal airway. That's what NPA stands for. It comes with that and some surgical lube to help with the insertion through the nose. With that, it'll allow a good airway for an unconscious patient, or you could also put that in somebody who you might suspect to become unconscious. And that way, you'll keep a patent airway the entire time. Now to go with that as well, there was also gunshot wounds to the chest, and that was causing pneumothoraxes, which could then lead to tension pneumothoraxes, lots of other secondary effects to that. So the Army came and they developed a chest seal, which essentially is just a massive sticker. Give me 1 second to pull it up. So with this, say you have a gunshot wound to the chest, you would find it, you would cover it up with your hand the best you could as you're getting this out of the equipment. Again, you have a little padding to kind of wipe away blood or any other fluids that are around there. You would pull it off the padding, and then you would slap it on there. On one full exhale is when you would slap it on. With that, you would ensure that it would block off that hole, which is allowing air into the lung cavity, offsetting the pressure in there. From there, you would then tape it up. So they put tape in here as well. The tape is good for many things. Going along with the chest seal, there's also the NCD, which is the needle chest decompression. It's a 14 gauge 3-inch needle. So when you take that out, it goes along with people with chest wounds. So say they get a sucking chest wound, they start to develop a pneumothorax, and the chest seal is not working. You can then put this into their chest, between the second and third rib, and that will allow that extra added air to escape. It also comes with gloves. Now, gloves are one of those catch-22 items. You want to use it to protect yourself from the injured person, but you also want to kind of use it to help the injured person. But you don't want to use it if it's going to take up so much time that you won't be able to apply the necessary interventions in the necessary time. So it's in here if you can use it, but it's not necessary. They also put in just some compressed gauze. This can be good for anything as far as helping pack the combat gauze into a wound. This one's not impregnated with any hemostatic agents, so it's just there. You can wrap it around the head, anything like that. And then getting back to the CLS class, the Army has implemented it to be a 40-hour class, and the students will go through, they'll do the classroom portion, and they will do hands-on portion, and from that they'll learn how to properly use all of these interventions to help save a life. This is good for the Army because the Army also has a thing called the golden hour, and within that it's that first hour of care, which is where you want to get the casualty from the point of injury to a hospital to get that higher care. Also with CLS, it's a good thing that the Army has now, just from the way that they've evolved from the old Army, where the medic ran around from foxhole to foxhole or whatever fighting position they had to scoop up the casualties and bring them to their site. Now the Army has it where the CLS will be that first person on site, so you want them to be properly trained. because they're going to be that first line. They're going to take them, bring them to the medics who are off the line, who can then properly fix these interventions if need be, or do extra interventions, and then get them off to higher care, such as a helicopter. And do I have any questions? Yes.
What does an IFAC stand for?
Improvised Field Aid Kit. Any other questions?
You said the combat gauze is impregnated. How does that happen? Is it like a mama's combat gauze?
Nope. So they just they take the agent that's gonna then go into it, and then they just attach it to the gauze. Yes.
What is a pneumothorax?
So when there's so you have your lung cavity with the two lungs, and as the air pressure comes in, it'll push against one lung, pressing it to the other side, not allowing it to expand. Yes.
How do you treat that pneumothorax?
The NCD. You're gonna treat it with your chest seal. You're gonna put it over the wound, and then you're gonna put the NCD in. And that's it. Thanks for coming.